Please join me in welcoming Lois Quam.
Well, good morning, and thank you, Tom and Carol. It's tremendous to be home. As I've traveled around the world, you can be just about anywhere and find a Minnesotan. Whether it is Ambassador Scott DeLisi, who's our ambassador in Uganda, or the head of the U.S. Agency for International Development in Mozambique, or there was one interesting day on the 7th floor at the State Department where Secretary Clinton's office is, where a couple of us were sitting and talking about some of the challenges we faced. And we realized that we were all three products of Minnesota public schools. Tom Nides, yes, that's what we have. Tom Nides, who's the who's the Deputy Secretary at the State Department for Management and Budget, graduated from the Duluth school system. Jacob Sullivan, who's the Director of Policy and Planning for the Secretary, graduated from Minneapolis South, and I graduated from Marshall High School. And in fact, we have decided that after we leave office with the Secretary, we're going to come back and do a little tour in Minnesota to reflect our appreciation for Minnesota public schools. So one thing I can tell you in terms of what you can do about global health or anything else in foreign policy is to support our public education system, which is truly unique here in Minnesota. So thank you. You can be very proud of your country and what we do in global health. We have a significant investment in global health around the world, and we have sustained that investment in the face of many challenges. We do that because it's very important to the American people in the world. First and foremost, our investments in global health protect Americans from the threat of infectious disease. As Tom mentioned, a threat that is ever more real with a more global economy. I have been in meetings at the Operations Center at the Centers for Disease Control in Atlanta, monitoring kids, what has happened when kids with measles end up at Dulles Airport. In a more global world with so much more global travel, the threat to Americans of the spread of infectious disease, either old infectious disease like measles or new infectious disease, is very real. And the work that we do in global health plays the protective role for the whole international community. There is no equivalent to CDC anywhere else in the world. CDC is the front line for the entire world in terms of the spread of infectious disease. And so our investments in global health, in stemming the tide of infectious disease, in being able to detect disease early and go forward, is a vital part of why we do global health. The second reason that we invest in global health is to build stronger countries. Countries who can prosper, countries who can invent new ways of working that will allow us all to move forward, countries who can be beacons of peace and security rather than failed states, countries that can be important trading partners. A country that suffers from poor health, and there are parts of the world that are stricken by neglected tropical disease, which means that whole communities are ill. Countries where a mother bleeds to death giving birth, well, that's when a nation bleeds. Cannot be strong nations providing leadership. And we see an enormous connection, whether it's in the Democratic Republic of Congo or Nigeria or other places in the world, between the challenges of global health and building stronger nations. So we seek to do our work in global health in a way that isn't simply humanitarian, though it always is, but does it in a way that works with country governments, both at the national and local level, that works with faith-based organizations, which in Africa, in many cases, provides up to 70% of all the healthcare services, which works with universities, civil society, women's groups on the ground, so that health can be a part of building a stronger community, a stronger society. And we see that working every day in a very valuable and exciting way. And the third reason we do global health is really because we can. We do global health because it saves lives. And because we have the capacity in this country to save lives around the world, we're deeply drawn to doing so. When President Bush put forward PEPFAR, the President's Emergency Plan for AIDS Relief, and the President's Malaria Initiative, that was in recognition that the United States, through its energy and investment and willing to try, could change the force of history with the AIDS epidemic globally. And in fact, that's what we've done. It's amazing to travel in Uganda, for example, and have people tell you what it was like before PEPFAR and what it's like now. Or to be in Western Kenya, where there are tens of thousands of orphans from the early stage of the AIDS epidemic. But now you can meet with mothers, fathers, and their children who are HIV positive, and there is still a community. PEPFAR made a huge difference. And this administration has been an excellent steward of the work that President Bush started, taking it forward, taking it to the next level, moving in new ways to bring this work forward. So that's why we do global health. That's why it's a priority for us. It is important to our security. It's important to the United States. It saves lives here. It saves lives around the world. And it builds a stronger nation. Now, we've been doing this work for 65 years. CDC was founded 65 years ago. The U.S. Agency for International Development 50 years ago. We have made, and then when President Bush came in, as I said, he made this big new investment. So when President Obama and President Clinton, or Secretary Clinton came in to look at where we were, what we realized was we had a large investment, but in some ways it was really quite fragmented. So we had a program for HIV, we had a program for malaria, we had a program for tuberculosis, we had a separate program around each challenge. And we were unwittingly creating some new challenges by doing it that way. Now, in a way, you had no choice when the AIDS epidemic was at its height to do anything else. But what it meant on the ground is for a mother in Kenya with small children, she would need to go one place if she was expecting to get maternity care, another place to get vaccinations for her children, another place if she or one of her loved ones had HIV to get that care, and another place to get bed nets for malaria. We made it difficult for local and national governments to work with us because it was so complex at times. And for healthcare workers on the ground, keeping track of everything, we didn't leverage what we had. So when President Obama came in office, he inaugurated the Global Health Initiative to bring a new approach to our work in global health, to take the fine work that we were doing and integrate it on the ground so that we could have greater effectiveness. We could save more lives, and we could do a better job at helping local communities take over the services we were providing them going forward. We also hoped we could make some new investments in health care for mothers and children. The challenges to the U.S. economy, the challenge to the global economy, meant that we could not make a new significant budget commitment. And that made our change in approach even more important, because it meant that the way we could bring new resources to these fights was by working differently. And we in Minnesota know a lot about that, whether it's in our companies or at our university, how we organize the way we work, to free up new resources to do the exciting things we need to do. And that is what the Global Health Initiative has been about, an ambitious set of goals and working in a new way. We asked as a part of that our ambassadors to step into a new role. Our ambassadors really to be chief executives of our presence in country. Our ambassadors to convene the Agency for International Development, which looks at global health as it relates to everything else, as saving mothers' lives in labor and delivery relates to girls' education, the marriage age that girls marry and have their first child, bringing the CDC in that looks at global health with regard to epidemics and how do we find the shortest, fastest line to solve a big problem. Or the Peace Corps, which is in the last mile, delivering bed nets in the smallest communities, the most remote communities. The National Institutes of Health that does important research globally to understand the underlying nature and biology of the diseases that face all of us. The PEPFAR program and its work around AIDS, which means now that there is a safe blood supply in Africa and that we can build on the safety of a blood supply in Africa. I had such fun a couple months ago opening a new clinic to have voluntary donations in Kampala that the CDC developed with the Ugandan government to ensure that there was safe testing of donors and safe setup. Very exciting. And all the other parts of the U.S. government's work in global health around one table to develop an integrated plan of services to attack these problems and then to work with local organizations, local churches, local governments, the national government to get that done. And that's what the Global Health Initiative has been about. We focused very much on three areas, which we see building the platform that then will allow us to take new challenges into the future. The first is continuing the work of PEPFAR to do what Secretary Clinton has called creating now the first AIDS-free generation. And what that means is our getting ahead of the curve, which means big investments and work to ensure that mothers who are HIV positive don't pass on AIDS to their children. To do the work to make sure that the full range of what are really now a very exciting set of ways to prevent HIV are in place. Perhaps the most important is the significant work that's being done by governments around the world to offer men the opportunity for voluntary circumcision as adults. Hundreds and hundreds of thousands of men have participated in this as one of the most effective ways of stopping the spread of HIV. So part of the work that we're doing is to build on what we've done with the PEPFAR program and take it to a different level. Secondly, we are working with partner countries around the world to end preventable child deaths. Over the last 50 years, the number of children under 5 who die has decreased by 70%. But every year, still more than 7 million children lose their life for preventable reasons, mostly diarrhea, before their 5th birthday. We had a very exciting meeting in Washington in June in partnership with the governments of India and Ethiopia. It was very neat because it wasn't a donor conference. It was a conference of three important nations in the world, the United States, India, and Ethiopia, to pull together a child survival call to action to re-energize our efforts to end preventable child deaths so all kids can reach their 5th birthday. And 124 governments and 120 civil society organizations have signed a pledge for this work, and the follow-up meetings are occurring in Nigeria, India, and Ethiopia. Nigeria has launched, as a result of this, the Saving 1 Million Lives initiative to accelerate progress in maternal and child health survival in 2015. The Democratic Republic of Congo has approved a significant doubling of their healthcare budget, investing in kids. So we see this as one of our most important goals, one of the best ways that we can build stronger states around the world. And the third area we have focused on is investing in women and saving mothers. About 1,000 women will die today around the world giving birth. Most of them will bleed to death. Most of them, their lives could have been readily saved by the most basic access to medical care. And this tragedy undermines the ability of all women to play their rightful role in their families and the society, and to build the kind of society that we need for states to achieve their full potential. Now, it's very hard to prevent. There's no vaccine. There's no drug. There's only one way to ensure a woman survives in labor and delivery, and that is that you have to have a healthcare system that can work in real time. If someone comes into a clinic to get a drug and the drug isn't available, or to get a shot, and they come back at the end of the week, it's not good that it wasn't there, because they might not come back, but they're going to be okay. If a mother comes in to deliver and the services aren't there, there's no one skilled who can help there, there's no one who knows the warning signs, there's no one who can transport her to a place where she might be able to get a C-section, she loses her life. And we have set up a significant public-private partnership called Saving Mothers, Giving Life. Secretary Clinton and Foreign Minister of Norway, Jonas Gahr Støre, announced this partnership in Oslo on June 1st to focus on the 24 hours of labor and delivery, that kind of golden window when 2/3 of women who die in pregnancy lose their life and half of infants, so that we have a joined up healthcare delivery system, and that women know that there's a way to get to a clinic, and that when they get there, there'll be somebody there who knows what the warning signs are, who knows to help them, and that if they need to get to the next level care, that there'll be a way to get there, and there'll be someone there who knows how to do a C-section. We have launched this work in 4 districts in Uganda and Zambia, and the progress is really exciting. There are frequently days when I come to work in the morning and there's a report about a mother whose lives has been saved. We're getting the initial statistics. This is a very new effort. But one of the most exciting things about it is it will mean that this stronger healthcare delivery system that has saved the lives of these mothers, by the way, will save lives for everybody else. People stricken with illness, people in road accidents. It's a way of building capacity across the healthcare system as a whole. So that's where we are. Your government is investing and working with faith-based communities, organizations, countries around the world, be it Norway or Zambia, to get this work underway. Now, where are we going? As Tom said, we have made a commitment to invest in global health diplomacy in a new way. We see significant opportunity to marry our efforts around global health with the leadership of our ambassadors and the Foreign Service across the State Department to make sure that health is a priority in our diplomatic efforts, so that our discussions around health aren't just at the health level, but they're at the level with heads of state in countries, both partner countries and other donor countries, and that when the Secretary of State travels around the world, that health is one of the major themes that he or she will put forward in the years to come. I'm very pleased that we're establishing a new Office of Global Health Diplomacy, which will be led by an ambassador at large, and we're putting that in place now. This will be the first enduring global health diplomatic office in the United States. Builds on important work other governments have done in this same space. Norway and Sweden have a role of this nature. And we envision that it will encourage other donors to maintain or expand their commitments and for us to coordinate them better so they can be more effective. That we will be able to engage with partner countries more effectively so that they can take up the responsibility for their own healthcare systems and we can provide strategic and technical support. And that we'll be able to coordinate in-country services in a different way so that it can have higher impact. And I can tell you from my experience to go into a country and meet with national leadership and say that the United States is very concerned about the number of women who lose their life in labor and delivery, and that we want to work together with a new level of urgency to make a difference here, that gets a lot of attention. And so in our Office of Global Health Diplomacy and all that represents in our work around the world, we envision building on this 65-year record so that into the future we will have stronger nations, we will have saved the lives of Americans and people around the world through our efforts. And I do hope to all the students here today that you will consider taking up this mantle as part of your work as you select your own careers. There's going to be a lot to do, and it's going to take fresh thinking that we know you'll bring. So Tom and Carol, thank you very much. I'd be happy to take a few questions.